Hey everyone, this week we're going to do it a little bit different. Obviously, I don't have my son here with me, but we're going to give you the components of the cardiovascular assessment, and then you put them all together and develop your own flow, okay? All right, so first part is inspection. So we're looking at general skins, we're looking at color and moisture. So color, we're looking for any duskiness or any undue pallor. They're really pale, that's not congruent with their ethnicity. We're looking for cyanosis or a little bit of a blue tinge. Central would be circumoral cyanosis or peripheral cyanosis, like in the nail beds, okay? So we're also checking for temperature. So we do have to kind of check the skin along the way with the back of our hands. Are we feeling any moisture on there? Maybe they're flushing for some reason, producing some moisture, or are they really cold and they're vasoconstricting due to coldness or maybe a medication or something like that. Also, we are checking for vascularity, so any spider veins or any varicosities anywhere in their legs, varicose veins, okay. Next coming up is the nail beds. So we're looking again at all of our nail beds on the fingers as well as the toes, okay, so that should be familiar territory to you guys. All right, let's move on to the carotid arteries, okay? So the carotids are on each side, right? Okay, and we're going to auscultate with our stethoscope. Now, the trachea is right there, so we are going to want to have them hold their breath. So we can differentiate between the sounds of the trachea versus the heartbeat, right? Okay, so of course stethoscope buds in your ear, and then just tap so you realize which side you're going to use. We're going to use both the diaphragm and the bell. This is the bell, this is the diaphragm, right? Okay, and then you're going to place it there and then have them hold their breath and listen. What you're going to hear is the carotid artery pulse. What you don't want to hear is you don't want to hear what's called a bruit, which is a swishing sound. Okay, you really want to hear a quick snap, snap, thump, 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 thump of the heartbeat. Okay, so listen with your diaphragm. And then also listen with the bell. Remember, if you have a two-sided stethoscope head, then you need to rotate it around the other way so that you can hear through that side. And then listen, okay? And do the other side, listen. And do the bell, and listen, okay? So you're really listening for any bruits and also if it's brisk, okay? All right, so moving on, we are also going to auscultate the apical pulse. So the apical pulse is located, excuse me, sir, mid-clavicular line, mid-clavicle line, fifth intercostal space. Okay, so we could take the time to measure down, but we're just going to do a gross placement of our stethoscope head, and typically it's right over here by the breast on this side. So if you have a female patient or you have a patient with pendulous breasts, then have them lift up for you. And then you are going to listen to the apical pulse with the diaphragm, okay? Okay, diaphragm, because the diaphragm is better at hearing the high-pitched tones of S1, S2, okay? The mitral valve and the aortic valve closures, okay? Snapping closures. So you're gonna listen here, and you're gonna listen for 60 seconds. Okay, so have a watch on that you're counting. Okay, yes, full 60 seconds. So remember that number for report, and also for report, we just want you to know if it's regular or irregular. Okay, regular or irregular. Okay, all right, let me get my guy dressed. So I wanted to insert a little additional thing about the apical pulse is that, of course, you're going to keep your shirt on your patient and you're going to go underneath and lift up and slide it underneath so that You're in about that area so that we can provide dignity and privacy for our patients, okay? So you take a little peeky poo underneath there so that you're in the right spot, but we're gonna have our patient be covered, okay? Apical radial pulse variability. What that is about cardiac output and perfusion. Someone from the hospital saying they're busy over at St. Jude. So what the apical radial pulse variability is when we get down to doing the radial pulses. Is our cardiac output strong enough to perfuse all the way down to our radial pulses? Okay, so if I was counting, 65 here, but I was like feeling, and I'm like, wait a minute, I barely feel 30. Now you don't have to count for a full 60 seconds, but do a gross observation of, do I feel like I'm feeling every beat being perfused? Or if it is a perfusion beat, is it less than the one before? So it's like, this one's okay, but the other one's like barely there. Next one, okay, barely there. Okay. So that's going to kind of get your mind thinking about cardiac output. Okay, cardiac output, is it forceful enough to get to the periphery? Okay, so potentially of decreased tissue perfusion, right? So then we're going to go through our major arteries. So we're going to start with temporal, and we can do these at the same time, except for the carotids. These two are the same. What we want to do is grade them on a scale of 0 to 3. So 0 is absent. Uh-oh, I can't find it. Maybe I'm in the wrong place. But 1 is kind of diminished, or kind of thready is another term that we'll use. 2 is what's to be expected. It's brisk. It's a boop, 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 boop. Okay, or normal. And 3 is bounding. It's like, whoa, whoa, someone's in fluid overload. Okay, so we have to use our judgment. And as you gain more practice with more patients, you'll be able to kind of get a general feel of the difference between those terms and how your judgment and your charting would be for those. So we're going to do our temporal here. Then when we come down to the carotids, we do one at a time, because we don't want to decrease the blood flow to the head, right? Because it might pass out on us. And also we don't want to rub or go too low, because the carotid sinus is there. So that could also stimulate low heart rate also there. So stay away from too low. Okay, so come a little bit higher, almost like where the Adam's apple is. Okay, on one side and on the other. Okay, and then the next is the brachial. Do them both together, because you're measuring them for amplitude, so the 0 to 3 scale, but also are they equal? Okay, are both limbs getting the same amount of cardiac output? Okay, then we're going to come down and do our radial pulses. Remember to use fingers rather than your thumb, okay? And I like to use 2 fingers because I gain more space there. Okay, for equality. Now remember, with the radials, I'm going to be thinking about, is each beat the same amplitude, or am I losing some of my cardiac output down to the hands? Okay, then the other 2 pulses are going to be on the feet. So I'm going to give you a picture of those. And then we're going to check for edema. Okay, so pitting edema versus non-pitting edema, so swelling. So we're going to check on the arm, so you can just press, 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 okay? Pitting edema is it presses down and it stays, and it's like, oh, look at there, okay? Non-pitting edema is swelling, but you push on it and it comes right back up, okay? It doesn't stay pitted. So pitting edema is 1 plus 2 plus 3 plus 4 plus. So 1 plus is 2 millimeters, 2 plus is 4 millimeters of indentation, and it's a judgment, okay? 3+ is 6, and 4+ is 8 millimeters of depth of where you push down and it stayed. All right, and I do believe that may be about it. Thank you. Okay, so I wanted to show you the pulses on the feet. I was going to give you a picture, but I have my son home now. So the first pulse is right on top, and this is the dorsalis pedis. Careful not to push too hard because sometimes you obliterate them. So go a little bit lighter and maybe move down. Okay, his feet are cold, so these are like a 1+. Okay, and then the posterior tibialis is behind, so you can see how I'm kind of right there behind that ankle bone right there. Oh yeah, he's got good, yeah, so that would be a 2+ back there. And also for the edema, where you're gonna push is right here on top of the shins, and then on the top side of the foot, or the dorsal side of the foot, and then also again back here on that ankle bone, right? That the medial malleolus. Push on there to see if there's any indentation, whether it's pitting or non-pitting edema. Okay, thank you.